Diabetes mellitus in young can have many differentials. It can be MODY, it can be type 1 diabetes mellitus, it can also be Wolfram syndrome. MODY is maturity onset diabetes of young, which is an autosomal dominant disease with mutation of transcription factor, which is required for insulin synthesis. Therefore, there is decreased insulin with normal beta cell count seen in age group of less than 25 years with strong family history. Whereas type 1 diabetes mellitus is an autoimmune mediated destruction of beta cell, thereby decreasing the insulin synthesis. It can be due to mutation in T cell tolerance. It may or may not have family history. There is decreased or absent C-peptide in type 1 diabetes mellitus, whereas there is normal C-peptide in MODY. Depending on the type of MODY, the patient may require just metformin or glipizide can be enough, or they can also have insulin, whereas type 1 diabetes, they will have insulin dependence. The late progression of type 1 diabetes, which presents in more than 30-year-old patients, latent autoimmune diabetes in adults is LADA, whereas this type 1 diabetes will be usually by 30 years the patient will present with acute complications such as DKA. This LADA has a late progression and will have a late insulin dependence. Here also there is beta cell destruction autoimmune mediated. Therefore, there is decreased C-peptide here also. How to differentiate this from type 2 diabetes mellitus, which is also seen in adults, that is, they can be present in more than 30-year-old. Here there is no autoimmune mediated destruction. There is no there is insulin resistance and slow progression to insulin dependence. Another syndrome where we see childhood insulin dependent diabetes mellitus. Childhood insulin dependent diabetes mellitus is Wolfram syndrome, which is an autosomal recessive condition with mutation of WFS1, which is an protein in transmembrane of endoplasmic reticulum. Along with this diabetes mellitus, the patient presents with diabetes insipidus, optic atrophy, and the patient may also have deafness, neurodegenerative symptoms.